as we see an exponential rise in the case of heart attack and strokes, medical fraternity is worried that the caseload, for example, if left unchecked, could potentially overwhelm the Indian healthcare system. Now, what do you believe we should be focusing on when we are trying to orientate our healthcare systems? Also, of course, we've got a wake-up call after COVID-19. So what do you advocate, sir?
So, Rahul, I'm going to address that, and thank you very much for bringing this up. But also prior to that, we still haven't addressed one of the most important questions that everybody's asking. Seemingly fit. He was seemingly fit, or they were seemingly fit.
True.
And there have been a number of instances of seemingly fit, but still having a heart attack, and this happens in our lives as well. So how come a seemingly fit individual have a heart attack? And it's important to understand those aspects. For example, by the way, coronary artery disease, every Indian is like a loaded gun and can have a predisposition to coronary artery disease. That's just by genetics. Now, we have understood the risk factors from other speakers, but 25% of the heart disease, even severe blockages, are asymptomatic. You may not even know that you actually have those blockages and could be exercising with those blockages. So that's the first important point to understand, that not everybody complains of chest discomfort and pain with the blockages. The second important point is that you don't have to have severe blockages to get a heart attack. Even minor blockages of 30 and 40 and 50% can lead to major heart attacks, and that's our concern in the younger individuals who smoke heavily, because those blockages rupture and clot forms inside the artery and suddenly closes the artery completely to create a major heart attack, something which we see so regularly in our daily practice and are salvaging every day by treating and doing angioplasties on these patients to open those arteries up. And thirdly, also, that those who exercise vigorously, strenuously, endurance, can sometimes rupture these plaques and suddenly have a heart attack, even on a 30% blockage. And that is why, when you saw those movies where some, a father on listening something from a son or daughter gets stressed and has a severe chest pain, those are the instances of stress, of severe stress producing heart attacks. And finally, one thing people have not understood, and I must emphasize, moderate exercise, as described by my colleagues, helps heart and decreases the risk of heart attack by 20%. That's something which best of the medicines don't do. Yet, severe exercise, heavy exercising, endurance exercise can actually damage the heart as well. Scarring has been noted in the heart. Hypertrophic cardiomyopathy has been noted in the heart. And rare instances of cardiac arrest and arrhythmias have been noted. And that's why you see those situations and instances where a fitness fanatic, someone who was playing football and has been exercising to play football, suddenly actually has a collapse and then has to be resuscitated. So those are important. By the way, when we talk about prevention, I would say that anybody who has a family history of early death in the family, of having had heart attacks, of diabetes and hypertension should be getting tested by the age of 20. There is, Dr. Devi Shetty is right in saying that we should recommend testing in those who are going to take up severe exercise schedules. They have to be gradual, they have to be moderate, but at any age, even those going to college and saying, I'm going to take up severe exercise sports, should have an echocardiogram done, because it is well recognized that congenital QT prolongations, hypertrophic cardiomyopathy are the causes of death in young people less than 25 years who take up severe endurance sports. And by the way, it's mandatory in the United States for college boys who actually take up college sports and college teams to actually go through these tests. Finally, you asked me about what can be done for all this. This is a huge warning for India. Coronary artery disease has risen in young individuals by 200% over the last 15 to 20 years. We know that we are the heart attack capital of the world. We know that 25% of our heart attacks are happening in less than 40 years of age. And actually prevention is certainly in our hands mainly. We want to, of course, have anti-tobacco lobbies clearly. We have to have anti-tobacco laws. We have to have anti-trans fats laws as well. But clearly, if you actually look at the fact that how many people do exercise regularly, when exercise, moderate exercise can decrease heart attacks by 25%, then believe you me, I could say it's only not even in our hands, it's on our feet. All we need to do is buy keds, walk regularly. I would say 200 minutes a week, not 150 minutes a week. I'd say 45 minutes a day of brisk exercising or mild jogging or cycling or swimming, aerobic exercises which decrease the incidence of heart attacks, and that's been well demonstrated, and that's as good as you can go. It's in our hands.
Okay, that's interesting.
I'd say in our feet.
I also want to, fair enough, I also want to, Professor